my name is Kim. I am the clinic manager for Dr. Yunus Doğan and his team. We are located here in Istanbul, Turkey. Today we're going to talk to all three of our doctors. Let me introduce them. First we have Dr. Yunus Doğan, the legend.
Thank you. This is Dr. Yunus Doğan, and I'm plastic surgeon. And Dr. Jamil is plastic surgeon as well, and Dr. Ahmed, plastic surgeon. We are a team, a great team, and doing hard works. That's it.
Today we will be talking about breast implants. We want our patients to be informed before they come, so we want them to feel prepared. They know how to prepare and the questions to ask. So today I'm going to ask you guys some questions and I'll let you answer them so people will be aware before they even get here about what we do, what we use, and why we use them. So let's get started with what brand of implants do we use and why?
Okay. First of all, before brands, I want to tell something. We will talk our opinion. Okay? Mm-hmm. There are a lot of scientific publications before, and there are a lot of correct way, but we will inform people about our opinion, our window, I can say. And then the brands, there are a lot of brands in market, and we don't use just one of them. And I don't want to give any name, just I can say the things about these implants. We are looking, when we choose, we are looking their CE certification or FDA approval. Okay, these are our essential points for implants. There are a lot of brands in market, and we feel comfortable with some of them because we use it to use them, but this doesn't mean that the others are not good or are not available. We can put when a patient wants another brand. Okay?
The important point is CA certification and FDA approval. If it's okay, be okay with that.
Yes.
Excellent.
That's the point.
Yeah, excellent. Do we use textured or smooth?
We use both, and last 3 years especially we are using smooth one and round one. For anatomic implants there is no available smooth implants. They are just textured, and if we choose anatomic implant we have to use textured one, but for round implants almost always we use smooth implants.
Excellent. Is there a reason why you prefer smooth?
Smooth one, there are a lot of reasons. The first thing is soft, okay, softer than the others, textured one, and more natural feeling when we touch. And the other reason is maybe you want to tell it about the lymphoma issue.
Yeah, in recent years there are some kind of lymphoma, some kind of disease with silicone implants, and when we check out the papers, we can clearly see that with round implants it is seen rarely, less than textured or micro-textured implants. This is not an opinion or correct way, but they say that the paper says that we can get information from them, and round one is safer than textured one. So we want to stay in safe lanes. We use this reason. Rounds.
Maybe I can add something more. Recent reviews showed us that this is large cell lymphoma or implant-related disease are likely to happen with textured one. But for smooth one, there is no evidence about this. For this reason, we don't want to take any extra risk for this. For this reason, we use usually smooth one.
Excellent. A question we always hear is, where do we place them? Do we place them under the muscle, over the muscle, and why?
To be honest, I like to put it under muscle. There are a lot of reasons for this. I put just maybe 4 or 5 implants. I can remember their names even. Over muscle plane or subfacial plane. But under muscle plane, dual plane, I mean, is also safer because there will be less capsular contractile rate and implant will be stable more than over muscle plane, and I use it to do it also. And also the skin coverage, sometimes it won't be enough for cover this implant. For this reason we might need additional thickness over this implant. For this reason, we usually prefer to do it under muscle plane, dual plane, I mean.
We often hear that putting it under the muscle is very painful after for recovery. Is there something that you do that helps with that?
Yes, it's painful, and first few days or first few weeks it might be painful, but for this reason we have a motto: if patient doesn't meet with this pain, she won't have in future even. Okay, for this reason at the end of surgery I do muscle block with ultrasound guide, PAX block its name, and with this way it's really less painful.
For pain management, we are using nerve blocks, as you mentioned before.
Mm-hmm.
And I think there are a lot of kind of surgeries in plastic surgery. Breast implant surgery not the most painful one. Even our patients says that they feel kind of fullness after surgery, but not too many painful, I think. They are handling it well with painkillers, and after a few days, they're okay with daily lives.
How do you go about choosing a size for someone?
Maybe you can talk about wishes, patient wishes, and what we do.
Yeah.
Actually, there are no absolutes in plastic surgery. Patient opinion in this particular line is really important. Wish pictures and patient preferences.
Instagram live.
Yes, important, but it's kind of challenging to meet these goals actually. We almost always care for the patient's opinions, but the body and the pocket of breast size is the main important thing in this surgery. I think we almost achieve our goals with patients, but we choose size with patient and we set goals with patients also.
Okay, I usually ask patient, what is your wish? And there is an algorithm for this in my mind. Okay, there are 3 steps. First step, I want to be shown with my implants, even I got dressed. Okay, this is the biggest, this means biggest implant, as big as we can. The second one, only just bikini or underwear, I want people realize my breast. This is second type. The third one is just I want people realize my breast, just I'm naked. Okay, this is the smallest one. And when we hear these from patient, we check their measurements. Base height of breast, the lower pole thickness, upper pole thickness, and also nipple to inframammalian fold distance. These are the measurements that we use to choose which implant is the best option. And the third step is surgery. We have sizers like these implants, smooth sizers. And during surgery, we check the measurements and we remember what patient wants, and then based on this knowledge, we try sizers. After that, we check if they are okay, if we can reach these goals with this size. We decide, and then we put the original implant. Okay, this is how it works.
Excellent. When are implants not advised?
Actually, it's if patient's IMF to nipple measurement is too much for implant surgery. We sometimes use two-step surgeries. One is lift only, after that implant after 3 or 4 months. But yes, from I
5 degree.
yes high ptosis, yes.
So if the distance is too far, if their breasts are too large or too...
Large is not.
No, I know, not too...
I mean length.
Yeah.
Length is
Length between the notch to nipple distance over than 28 centimeter is our limit, up limit. Over than this, we don't prefer to do breast implant surgery, just breast implant surgery, and even breast lift implant surgery. We don't choose over than 28 centimeter.
All right. And another question is, do you always need a lift when you get implants?
This is not an absolute indication. The distance between nipple and notch is, if it's between 18 to 22, usually we don't need to do lifting. Okay, over than 22 centimeter, this depends patient to patient. Okay, we cannot say something certain. Okay, we have to check patient, because sometimes even 25 centimeter distance patient doesn't need to do lift, because the footprint of breast might be low placed. Okay, so no need to do any lifting. Okay, this depends patient to patient. We can say like this.
All right. Well, so that was a lot of the information about implants. We have a couple of after procedure, but we're running out of time, so I'm going to go through them really quickly. How long do you need to wear a surgical bra?
Actually, 6 weeks will be suitable time for using them.
All right, so 6 weeks for a surgical bra. After implants, are your women allowed to wear underwire bras?
For before wound healing occurs, we don't recommend them. After wound healing, it's up to patient actually.
Okay, so after... Okay, after the 6 weeks of the surgical bra, or?
I think 6 weeks will be more.
Yes, 6 weeks is better.
Okay. What about breast massage? Do we need to do breast massage?
Yes, actually, after when we put implants, our body will produce a capsule around this. After this capsule formation, okay, around 1 month, we usually suggest to do massage to their breasts, and we send these videos, and also we show how they will do this. Okay, massage is a good way to soften this capsule. Okay.
Excellent. After a month. When can we go back to work?
It depends.
It depends the kind of work actually. After a couple of days, our patients can start with daily lives, but for hard working and using hard muscles, 6 weeks will be okay, but for daily life, I think 1 week is suitable.
Yes.
Yeah, computer work, things like that. Okay. All right. Working out. So working out would be after 6 weeks, but are there certain exercises one shouldn't do after breast implants?
Actually, our body will tell us, will tell the patient what they do or what they don't. Okay. So our body is our doctor and will tell us what we shouldn't do. Okay. If you move your arms over than 90 degree, or if you want to put your shoe closure, okay, there might be pain, and if you have pain, stop.
Okay. All right. Listen to your body. Last question. Can someone breastfeed after implants?
Yes, of course. There are some studies they said it is safe, and it is actually we put implants, even we put them sufficiently. We don't interfere with breast tissue. We almost always put them under and behind breast tissue. So breastfeeding and breast implant are different and separate things. So patients can breastfeeding with easily. And when we come to the chemical parts of the implant, studies show that it is safe to breastfeed with implants.
Excellent. Awesome. So thank you all so much for taking the time to do this with me. I know that the people that tune into us and watch all of our social media love to hear from you guys, hear these educational videos. So thank you so much, and I'm sure they'll look forward to our next video. Thank you.
Okay. See you. Thank you. See you. Bye-bye.